Yeah, I'm Marie. I'm from Germany. I'm the product manager for the TI Messenger. Why are we here today? I want to take you on a journey through the German healthcare system and tell you why and how we need the matrix protocol in order to get secure messaging to everyone. So you might think, well, let's take matrix, let's take something, and then we will get the TIM, the TI messenger. It's not as easy. We have many different people, stakeholders, needs. We have quite an old system, or a system that grew over years. We have a lot of bureaucracy. We have federal administrations, and we have a lot of people with a lot of passion, which is good on the one side because everyone wants to do something. On the other side, we have to kind of get all the needs together. In order to explain you what that is, I came up with a little graphic. So how is the German healthcare system in general made? This is a simplification. I thought I'll break it down for you. Let's start with the insured person. We always say insured people. That's the patients or the people that participate in the healthcare system. Those insured people are insured at the health insurers. The health insurers have their state associations, and the state associations have the national association. Then we have the hospitals, which are governed by the German Hospital Federation. We have this, I rehearsed that word quite a long time, statutory physicians that have the regional physicians associations for every Bundesland. And then they again have a national association. Then we have the pharmacies with their associations. We have the care associations with the nurses. They're a little bit outside of that system because they have, again, their own insurer system. I did not put that on there. And then we have the Federal Joint Committee that kind of governs it in some degree. And on top of everything, we have the Federal Ministry of Health. And we have quite a few more stakeholders. I did not put all of them in there. So what happened? Everyone wants to digitize the system, which is good. We don't want to stay in the old processes that we have. But how do you do that? How do you get all those interest groups into one decision to go for a matrix protocol or not? They all decided to found the Gematik. So I think this chart was around for last year as well, but I just wanted to show you. This is those are the shareholders of the Gematik. So we are mandated by a law in the social book 5 to digitize the healthcare system. We have as main stakeholder the German Federal Ministry of Health with 51%. So if we can't get all the needs together, they kind of say which way we go. So yeah, those are the interest groups that we as a product team at Gematik want to get together, and they're kind of they're like our bosses more or less. So it's just to give you an idea what our job at Gematik is. We want to think about here the insured person. We want to give them a good care. We want to digitize. I'm as a patient, I want to move through the system, and I don't want to have all those papers every time in my hand. So we try to get all those interest groups for the doctors, for the hospitals together. But what does that mean in numbers? Germany is quite big. And we have, all different kinds of people that need to use the products that we create or the TI messenger that we create. So we have approximately 83 million citizens. We have 5.7 million healthcare professionals. We have hospitals, pharmacies, you can see the numbers. yeah, so our job is to align those interests and to get the digitization into their primary systems, because all of them, they have different primary systems. The hospital uses a different software system than the doctor's office, and that's where it kind of becomes difficult in Germany. So in a nutshell, what we came up with is we want a decentralized end-to-end encrypted foundation for secure messaging across the healthcare ecosystem in Germany. You can't see the blue here. It's two different boxes. We heard it before. We have the TI Messenger Pro. That's a professional version for all those people using it. I broke it down. Who uses the TI Messenger Pro? It's the doctors and their staff. It's the hospital staff, the nursing staff, the pharmacy staff, and also the health insurances, which gives us approximately 100 institutions, or not institutions, vendors at the moment that kind of provide that messenger. And then we have the TI Messenger EPA. That's the messenger for the insured people. And the Federal Ministry of Health said, how do we get the messenger to all the insured people? They are probably not really going to pay for it. They expect the health insurance to pay for it anyway, so we might as well put it into the law. So by the 15th of July this year, all the health insurances got a TI Messenger and got it to the insured people, which is quite big, because now every insured person in Germany has the possibility to use a TI Messenger. But, oh, sorry. First, I want to show you the TI Messenger Pro. This is, it's quite simple. It's a messaging system. This is the first messenger that got a certification by us. It's the Family Messenger. You can send direct messages. You can chat in group chats. You can have intersectoral communication. You have a national directory and document exchange. Here we have the TI Messenger and the EPA. So some of you might have heard in Germany we launched the EPA, the electronic patient folder. That was like the big launch this year. And our TI Messenger is one part of that. So you go in the app of your insurance company and you can access with the authentication process your TI Messenger. So it's now my butt comes. Now all the insured people have possibly access to the TI Messenger, but they don't have a lot of people to chat with, because on the other side, we need the doctors, we need the hospitals, we need the insurance companies to have the TI Messenger Pro organized and in their everyday life to chat with. So this is kind of where we stand at the moment. We made the big step. We got the messenger to our patients. The infrastructure is there, it's provided, and now we need the adoption to the next level. We need to get doctors and all the staff to use the messenger. In Germany, doctors are used to getting paid for digitization. And they kind of expect the government or the insurance companies to pay the digitization step. And at the moment, by law, they were mandated to get the electronic patient folder. So they are kind of, they are not amused by getting more digitization into their practices. Not all of them, but the big mass of it. So that's kind of where we stand at the moment. That we need to get the doctors to see the use in that product, and to not stand there and say, hey, you don't want to do 1 million phone calls a day, right? So this is where we focus. We say we don't want to put it into the law that you're mandated to use a messaging app. We want the people to notice, okay, the usage, it's so important. So what I brought for you to understand what does using the messenger actually mean, because it's different. It's not a person to a person, it's institutions to institutions. Here I have a few use cases. We have a model region where we tested the TI messenger last year, and I have some quotes of that. This is a use case in a pharmacy, where pharmacy gets the information from the patient about a drug, and then the pharmacy says, oh, I can see an interaction, you need to change the drug prescription. And she texts us the doctor is like, oh, I'm sorry, okay, I need some more information. So this is a communication way that happens every day, many times in a pharmacy. And you can see, Sabine said, instead of calling 10 times the doctor's office and hanging in line, I can chat now, and she's really happy. So then we have the TI messenger in outpatient care, which is actually quite interesting, because the German system moves more and more into a wider spread of outpatient care. And what we need is we need to support the people that work to have more time for their patients. And with the TI messenger, they can take care of the patient directly on site. They can record the round, send that picture to the doctor. The doctor is like, oh, you need to do something, you need to do this and this and this, get this prescription. And that kind of communication that can happen now. At the moment, they have to call. The doctor takes care of a different patient, so they have to call back. So the round or different things, they get worse and worse. So it's really important to use this. And it's happening right now already with the TI messenger. And then we have the messenger for patients, of course. Here I have as an example a therapist in a clinic, a psycho clinic, where the patient goes in for like 8 weeks to get a treatment for depression. And what they like to do is have a digitized plan, have some interaction with the patient within the boundaries of the clinic. And that is something that can happen now. And that's where we want to move and get the TI messenger to all the clinics. I brought some numbers. Here we can see the numbers of our model region, the survey results, where we ask which communication method is replaced by TIM. And you can see here, it's the phone, it's the number one replacement, then the fax, then KIM, that's the secure email, and the walk to the doctor's office. Mainly they talk about medication plans, about the e-prescriptions, or they have internal communication with it. Another number, here we can see, you can see the colors. On the left side you have the way, how do you say? Schnellere Antwortzeit. So the way you reply, that you get faster replies. Thank you. And you can see that with TIM, they are delivered faster response times. You have improved reachability, and it really prevents misunderstandings in critical situations. That's what we're talking about. We're talking about patients that are in bad condition and they need help. Yeah. So, where are we moving? TIM Connect, we heard it before. We don't only have the messaging system or the need in the primary systems of the doctor's office or the patient itself that needs communication within the insurance app. We also have patient portals. We have platforms that do anamnesis, video communications, and we want to get those platforms to be able to do secure messaging as well. So this is where we're moving. As I said, we have a lot of stakeholders. They have a lot of different needs. That's where we are with this product at the moment. We are talking, we are aligning, And yeah, our team always wants to deliver fast. I mean, we are the ones working on it every day. So yeah, I'm really happy to see everyone participating. And yeah, in general, let's improve communication in the healthcare systems. Maybe not only in Germany, maybe we can also do this in different countries. If you want to have some best practices or whatever, you can always, talk to us. And here's my LinkedIn, so you can text me. And I'm happy to answer some questions. Thank you.
I already have one question from the online viewers. Will the TI messenger start to federate at some point in time so that in future I, as a patient, can use my established matrix ID to communicate with doctors, pharmacies, hospitals?
I don't think so. Because we have some special authentication processes in place in order to authenticate as a patient. So you need the electronic patient card in order to get into the federal health system in Germany. Yeah.
Okay. My matrix server is not working, so I will look at other clients. But yeah, keep sending your messages.
Okay, I'm going to ask a question, and I just full disclosure, I'm one of the vendors. Well, our company is one of the vendors, not me personally. You talked about insured people in the beginning, and then you said patients. It's not the same thing. In the German market, and we've talked to you, so I know that. How do you square the circle? Hospitals especially, but also doctors, have more than insured people as patients. If we want patients, we have to go away from limiting it always to insured people.
Yeah.
How do you do that?
So in general, why we talk about insured people is because we by law we are mandated to give the statutory health insurance, the TI messenger, and they have to give that to their insured people, and that's a stash for the statutory health insurance of about 80 million. And then we have also the people that are privately insured, that don't get the mandatory TI messenger because they're outside of the law area. I personally prefer to talk about patients because it kind of describes a little bit better what it's about. But the patients kind of suggest that you already have a sickness or that you are sick in some kind of way. And insured people, that you also have the mother that takes care of the daughter, or some more people. That's why we kind of say the insured people. It's a bigger pot in my point of view. You don't think so?
I disagree.
Okay. Well,
because people going from one country to another, like I live in Austria, I'm originally German.
Yeah.
If I go to Germany to a doctor, I'm not insured, I'm still a patient.
Yeah.
How do I get treated? How do I communicate with my doctor now? How do I exchange information? I can't.
Yeah.
Right? So
let's have a talk about this afterwards.
Hello. I have a question also. I saw the family app. The UI is decent, like it's very easy to use. But what about the patients and the physicians? How is the deployment? Like, do they need extra training? Like, are they aware of that? Like, are they used to use many applications? Because I don't know how in Germany, but in my country, like, if we try to deploy something, they're all against that because it's not the part of their existing ecosystem. And they're like, we will wait. Maybe something will happen. So what about this, this ecosystem?
Yeah, I heard that we will wait a few times as well. So if we talk about the doctors, for example, some of them want the integration into their primary system. Others don't. They say, hey, I use the messaging on my private phone and I just want to exchange fast messages. I think the most complicated part is for bigger organizations to understand how to change the general behavior of everyone working there, like coming away from messaging systems that they're not allowed to use into our system, which needs some more admin work to start with. You have the organizational structures that you need to register, and then you need to kind of put the hierarchy of the different stations of a clinic, for example, in there. So that takes a little bit more work, but once it's implemented, it's easy to use. It's how we know it. Yeah.
Okay, and last question, like, are they, like, the users, do they prefer, like, installable applications or more like browser-based web applications?
They prefer app users. Most of them don't want a browser application because it's to move, to walk around. Yeah.
Marie, could you give an idea as to how much TI Messenger has improved healthcare in Germany so far? Is it possible to measure it in any way? And also what difference it could make in the future?
Yeah. So regarding the measurement of the improvement of the care, I think it's difficult because it's quite a wide range. What I showed you in the statistics, that's what we have right now. We generally do Umfragen. What's the word in English? Surveys a few times in a year, and since the messenger for the patients just launched, I can't tell you yet how that improved. And what was the second question? Yeah. So the difference it could make in the future is, I think, with the TI Messenger, we can really change the behavior away from phone calls and from writing emails. We can change complete processes during their everyday life in doctors' offices and clinics. And I think that's also the challenge, because we can use automation into the systems. We don't need to answer every little thing. We can have systems that help us to triage our patients. That is something that in Germany people are like, oh yeah, we want help, but we are scared of it. So I think that's the gamble that we go.
Hi. Is it working? I don't think it's working. So how do you open chats with each other? So can a person, like patient, just... Oh, and now it works. Can a patient like search for a hospital or for a doctor, and is it just this direction, or can the doctor also open a chat with their patients, and how do they know that that's the right patient?
Yeah. So we have a directory, a doctors and an organizational directory in Germany. And in there, every doctor, every organization that wants can be listed there. And then we have a big allow and block concept on how doctors want to be found. Because if you don't want to be messaged by a patient directly, you don't have to, but then you contact the patient first. For the patient, it's the other way around. When I walk through our model region, for example, I have my TI Messenger app in my patient folder now, and I have a QR code there, and then I can just exchange that with the doctor or the pharmacy where I am at, and then we can communicate.
Hi. Okay. I wondered about the information on your messaging, but also on our files, so electronic health records and all that data that goes through. Are there separate solutions for managing that digitally, or is it integrated, or how does that work, or how it should work?
Yes, it's a big question, a big answer to a question. So general, we have the electronic patient folder where all the data of the patient now is stored, and we have the TI Messenger in the folder of the app from the patient where I can chat out of. But we don't have integrational function, as in I get my vital data from the doctor and then I save it in the patient folder. We don't have that yet, but those are like things to move to in the future. Yeah. There was one more question, or are we?
Yes. Under the EHDS, you have to also exchange cross-border.
Mm-hmm.
So how are you looking at that as well, to do that with the TI Messenger?
So we have in our company, we have a big sector of analyzing all that European law now, and we have to move into that direction, yes. But I can't give you a timeline yet.
And that is the end. Please give a huge round of applause again.
Thank you.